guys, now we're going to talk about the medical considerations for when you're working with a cancer patient and they're exercising. So we have four types of cancer. Carcinomas, sarcomas, leukemia, and lymphoma. And I'm just going to talk with you guys about each of these briefly so that when you hear about a cancer, you know what that word means. I think that's a helpful thing. Also, it's great when you're working with cancer patients, you can understand the development of their cancer and knowing what type of cancer it is. I think it's a really helpful thing because you'll understand where is it going to show up in the body. One type of cancer one of the types of cancer is called a carcinoma. So carcinomas are cancers of the epithelial tissues, and if you guys remember your anatomy, you know that epithelial tissues are everywhere. They line every blood vessel, every duct, every organ. We have them there all throughout the body. So carcinomas can develop in any of these epithelial tissues. So places where carcinomas appear include the skin, the GI tract, and the pulmonary system, and also in the breast, right? This is an example of breast cancer. So here's an example of breast cancer, and the previous example, when I showed you guys that ductal carcinoma in a cancer patient, that is a carcinoma, right? Ductal carcinoma of the milk of the ducts in the mammary glands. So examples of carcinomas include breast cancer, colorectal cancer, lung cancer, and prostate cancer. And let me kick back a little bit. So we'll have a tumor develop when those 1 or 2 or 3 cancerous cells grow and become a mass of cells, and then we can image those cells. That's why we cannot catch cancer right as it starts with imaging. Now, of course, technology is getting better and better and better, and there are lots of tests for cancer. But for example, when you're getting screened for breast cancer, you have a mammogram, and this is a picture of a mammogram. And what they do is they just look at the density of your breast tissue, and if they see an abnormal density someplace, then they will go and look further by biopsying it. So this is an example of carcinoma right here. Sarcomas are another type of cancer. These are tumors of the connective tissues in the bone. And these can also exist in the muscle, because if you remember again from anatomy, your muscle has muscle tissue, but my goodness, it has a lot of connective tissue forming all those different layers, the endomysium, the paramysium, the epimysium, all those layers of connective tissue surrounding and organizing muscle can have cancer tumors develop in there. Some examples of sarcomas are Ewingssarcoma, which is a bone cancer that develops often in young people and children, and then it's a tumor of the skeleton of the bones, because remember, bone is a type of connective tissue. Excuse me. Kaposi's sarcoma is another type of cancer. This develops in HIV and specifically in AIDS patients, and it's a disease of that connective tissue that shows up. Cancer of the connective tissue that shows up and is frequently kind of like a spot, has like a spotted type of appearance on the skin. So here's one example of Ewingssarcoma. I'm going to grab my pointer, but I don't think we need it. So here's our bone right here, and then here's the tumor that's developed on that bone. So Ewingssarcoma, osteosarcoma is another word for that. Leukemias and lymphomas. Leukemias, we don't have a picture of there because it's a blood cancer, so it's difficult to get an image of that. So cancers of the white blood cells include leukemias, and the lymphomas are cancers of the lymphatic system, such as Burkitt's lymphoma. And we see a poor little girl has this very large lymphoma tumor. That's a tumor in the lymph system. So what are some signs and some symptoms of cancer? Early on, they're very nonspecific, and it's people just start feeling really bad. They lose weight. We have fatigue because we lose weight because we may have GI problems associated with cancer. A lot of times nausea happens. We have fatigue, and also your body is fighting an invisible disease, and it's fighting very hard, and that takes a lot of energy. Fatigue, nausea, and malaise, or an overall just feeling of being unwell. As cancer develops further, we'll have symptoms that are specifically related to the affected organ. For example, if a person starts to develop lung cancer, their lungs are not going to function as well. They'll have shortness of breath. If they have GI cancer, they're going to have specific GI issues. potential vomiting, diarrhea, etc., problems of the digestive system, etc. Uh, Historically, their kind of family history and their social history can play a role. So, if family history, other folks in their family may have a certain type of cancer, you're more likely to have it from hereditary and also from heredity in your genetic code, and also from a shared lifestyle experience, often with your family. So some tests and treatment. Well, first we'll take a tumor sample with a biopsy, and then we do what's called staging. So you may have heard someone has a stage 1, stage 2, stage 0 tumor. Next, we stage it. We determine how far that cancer has spread. And once we determine the type of cancer and how far it's spread, we have 4 treatment options. And I talk about these treatment options specifically because this will impact you as you prescribe exercise to folks who have cancer. If a person's had surgery, we have to make sure there's adequate healing time. With radiation, we're going to have symptoms very specific to the area being radiated, as well as overall symptoms of nausea, fatigue, sometimes GI symptoms, etc. Chemotherapy can lead to, we're going to talk about some side effects of chemotherapy here, but chemotherapy can lead to some really severe side effects, nausea, vomiting, hair loss, bleeding, etc. And biotherapy, use of hormones and stem cells. We won't get into those too much. Okay, so real quick to kind of review these treatment options. Surgery, we're going to want to make sure we have adequate healing time as determined by the doctor. Radiation therapy, the specific system is going to be very affected by this. So if you're having a radiation therapy for lung cancer, the lungs are going to be affected by that, and maybe a person might have some shortness of breath that kind of goes along with the lung cancer they already have. Chemotherapy, we'll talk about next. Biotherapy, is basically when we use your immune system and we amp up your immune system to help you fight cancer, and that's going to have some flu-like symptoms that can be pretty rough too. All right, guys, this was a short one. That's okay. Hop on over to Canvas for your third assignment, and then we'll have lecture number 4, and then we'll be wrapping it up for the week.